Okay, well, thanks everybody for joining us on this dairy goat webinar, Managing and Feeding the Transition Doe. This is our first ISU Extension and Outreach Dairy Team webinar that we're specifically focusing on dairy goats. So this is hosted by our Iowa State University Extension and Outreach Dairy Team. So you may notice some colleagues on the call here today. My colleagues Fred Hall out in Northwest Iowa, and my colleague Larry Tranel, who is in Northeast and Southeast Iowa, and then myself, Jen Bentley. I work in Northeast Iowa as a dairy field specialist. While most of our focus has been on dairy cattle production, we do know that Iowa is one of the top states in dairy goat production, and realize the need for dairy education in the dairy goat world as well. And so we've collaborated with team members within the ISU Vet College on a grant this upcoming year and in the years to come to do some more educational programming. And so this work is also supported by the USDA National Institute of Food and Agriculture. Just a couple housekeeping things before we get started. As you're joining, just please mute your microphones, and if you can, turn off your cameras just to help with everybody's bandwidth as we're listening to the presentations here today. Some of the questions can be typed into the chat box, and we'll address those at the end of the presentations. So if you got questions along the way as people are presenting, go ahead and type those into the chat box. The webinar will be recorded and archived on our Extension Dairy Team page. And I have also put that into the chat box, so you can go ahead and save that link if you would like. The archived link will probably be up in the next day or two, and I'll also email that out to everybody that registered here today. I also already uploaded the PDFs of each of the presentations that we're going to have here today, so you can go ahead and download those at your leisure. I will also post those on the website as well if you'd like to get those later. After the program, we are going to have an evaluation, so I would appreciate, I'll post that in the chat box. You can click on that link, and that'll take you to a Qualtrics evaluation. It just gives us an idea of how the program went, what things that you learned here today, and give us a sense of other topics that we should be focusing on here in the future as well. Speaking of that, I did want to already put on your calendars March 3rd, noon to 1:15. We will also have a webinar talking about strategic kid management. So Dr. Roselle Bush from UC Davis, who I see is on the call as well, is going to be talking about getting those kids off to a good start, for a successful future. And multiple contagious diseases are transmitted to those young goats right around kidding. So during that webinar, we're going to be discussing recommended management practices to help control and minimize the spread of disease in your herd. So I'll be sending a registration link out for that as well if you'd like to already get registered. To begin today, our managing and feeding the transition doe, I'd like to introduce both of our presenters here this afternoon. First, we'd like to present Dr. Vicki Lauer. Dr. Lauer is a professional services veterinarian for Armor Animal Health, where she focuses on improving cattle and goat health through optimum management and prevention strategies. She works with multiple goat dairies and kid raisers throughout Wisconsin and has a small herd of registered Nubian dairy goats as well. Her presentation today will cover herd health concerns around the time of kidding and pre and post fresh management. We'll also have Morgan Allen, who's a nutritionist with Big Gain Incorporated, where she focuses on dairy cattle and dairy goat nutrition. She also owns a small commercial dairy goat farm located in southeast Minnesota. So she will be discussing feeding and managing the transition doe, bridging that nutrition from the dry and pregnant doe to the milking and non-pregnant doe. Before Dr. Lauer begins, I would like to do just a quick poll question of our audience here today, just to see who we have in the audience. So if you give me a second to launch that, it should pull up on your screen. And I just want to know where you are in the dairy goat industry. If you are a dairy goat producer, nutritionist, veterinarian, student, someone who's interested in dairy goats, industry representative, or an educator. So I'll give you a few more seconds to log in your votes and we'll see what kind of representation we have here today. Looks like we're about 75% complete on our poll. So I'll give you just a few more seconds. All right, so I'm going to end the poll. And you should be able to see the results. So you can see who our audience is here today. About 50% of our audience is dairy goat producers. We have nutritionists and veterinarians on the call, a few students, some that are interested in dairy goats. So quite a range of the industry here, and that's great. So with that, Dr. Lauer, I'm going to stop sharing and allow you to start sharing your screen.
Perfect. All right, can you see it? Okay, so hi everyone. My name is Dr. Vicki Lauer, and thank you for that nice introduction, Jen. And I'm very excited to be speaking to you all. So today we're going to go over some pre and post fresh doe care. And I have this aim pretty much for producers, so it's not going to be super high level, but hopefully you all can get some good info out of this. So you already know a little bit about me, but just one little plug. I am from Missouri. I've been in Wisconsin for the last almost 10 years, and I've been raising dairy goats for over 10 years. So with those dry does, I always like to start by discussing when do we actually dry those does off. Ideally, we want to aim for a 60-day dry period, and it's important to base this off of a strong breeding date. So one of the issues that I'll see is that maybe you're not exactly sure how far along pregnant that doe is, so then she doesn't get that full 60-day dry period. It leads to more health issues in those does in general. And just a quick refresher, goats do have 150-day approximately gestation. So it can be, plus or minus a few days depending on the breed. When calculating that due date, don't just go off of 5 months, because we all know that months are different length. So go by that 150 days. For easy figuring, I figure it's 2 weeks plus 3 days. That'll put you at that 150 days. During the dry period, there are some goals that you want to hit for those does that maybe are lower in body condition, and we will discuss body condition later on today. We do want to try and get them up to a more ideal body condition. So technically with them, we want them to be gaining some weight. Most of the other does, if they're in adequate body condition, we just try and maintain that same body condition. And during dry off, we're trying to prepare those does for their next lactation. That's the whole goal. As far as I know, there haven't been very many studies in goats looking at, okay, what are the benefits of a 60-day dry period versus a 30-day dry period. But in cows, there's been some pretty solid data showing that those 60-day dry periods do increase milk production for that next lactation. And then during that dry period, the doe is going to be building the antibody levels in her colostrum. Better quality colostrum means healthier kids. So if you came from maybe a dairy cow world, you know that just doing standardized dry cow therapy all across the board is pretty common. Nowadays, we've been talking more about selective dry cow therapy, but most farms just dry treat all of their cows. Now, that's not the case for goats for a few different reasons. Generally, I don't recommend dry treating those does unless they had mastitis during their lactation, or they've had very high, like consistently high somatic cell count based on their DHI record. Reason why we don't recommend just going and group treating everybody with those dry cow tubes is that goats have a lot tighter teat sphincter than cows do. And because of that, it's a lot easier to damage that teat sphincter. So basically, if you do insert the dry cow tube into that teat end, you are causing damage to that teat sphincter, and you're increasing the chances of that goat getting mastitis, which we don't want. Now, if you do have a goat, again, that has mastitis with that chronic high somatic cell count, and she does need to be dry treated, make sure you prep that teat end so that it is sterile. I do use 1 full tube per half, and then afterwards do a good post-dip. Some of those dry cow tubes have a full insertion or a partial insertion tip. Definitely go with that partial insertion tip so that you're not causing any extra damage to the inside of the teat. As far as vaccines go, during the dry period is a great time to vaccinate those does, typically with the CD&T vaccine. I personally use Cavalry 9. That's what I kind of recommend here in Wisconsin. It's not labeled for sheep or for goats, but I've had very good success with it. Ideally, we want to vaccinate those does around 8 weeks before kidding. The reason why is that goats, similarly to cows, they start moving all the antibodies from their bloodstream into the udder to basically build the colostral antibody levels about 5 weeks before they're due. Now, when we give a vaccine, it's going to take 2 to 3 weeks for the blood levels of those antibodies to reach their maximum height. So if you do that 5 weeks plus 3 weeks, that gives you that 8-week goal. Now, if it's been more than a year since does were vaccinated with the CD&T vaccine, they would need to be kind of primed. So they would need to get an initial CD&T vaccine 12 weeks before their due date, plus a second one 8 weeks before their due date. Deworming is another somewhat important thing. We could talk about parasite resistance for a long time, so I'm just kind of touching on this. But when does are pregnant and they're getting close to kidding, those parasites, they know just based on the higher hormone levels that the doe is getting ready to kid. And so there are a lot more parasites being spread in the manure. The goat is immunosuppressed. And so, yeah, there are just more eggs being passed. So deworming around 2 to 3 weeks before the due date is fairly commonly done. With goats, we only recommend using oral dewormers. Again, that's because of parasite resistance issues. If you do a pour-on or an injectable dewormer, then the blood levels slowly decrease over time, which increases the chances of those parasites becoming resistant to the dewormers. So only oral dewormers. Ideally, you want to hold those does off of hay for the 12 hours beforehand. That's just so there's not as much stuff. There's not as much fiber in the rumen and then the intestines, so that our dewormers will be more effective. Safeguard and Rumetel are the only two that are actually labeled for goats. Rumetel is labeled for lactating goats, so that's a plus. Safeguard can be used in dry goats as well. So those are both safe. Definitely do not use valbazen during the last 2 months of pregnancy because it can cause abortions. And then don't use levamisole on pregnant does at all. There's a lot of toxicity issues because the margin of safety is a whole lot more narrow. Otherwise, there are several other dewormers that can be used. They are just extra label, so a vet would need to recommend them and provide a milk and a meat withhold for you. I put on there wormx.info. That is a really good website for you to refer to. It has some really great just general info on dewormers, and it has some helpful charts where it has the weight of the goat, some different dewormers that can be used. So it's very handy, very quick, and it's kept up to date quite well. I do recommend doing a pour-on for external parasites, especially lice and mites. Ultraboss is labeled for lactating goats. There's no milk withhold, so that's what I typically recommend. Other things to be done during the dry period, typically doing some sort of injectable selenium product, whether obese or multimin. Those are the two most commonly used up here in Wisconsin. Typically we do those about a month before the does are due. And that's simply to boost the selenium levels, or in the case of obese, the vitamin E levels as well. I personally prefer multimin just because it has zinc in there, which is great for some zinc deficiency skin conditions. And then it does have a low level of copper. Here in Wisconsin, almost all the goats I've seen have been copper deficient, so we really don't worry about any sort of copper toxicity here. But again, that's Wisconsin. So it could definitely be different depending on where in the country you live. And I know we have people from all over the place. Both of these products are extra label, so a veterinarian, again, would need to recommend them, provide milk and meat withholds for you. I do also recommend doing what's called a milking clip, so not a fancy show clip like in that picture up there, but just a basic udder clip. So you're clipping the udder, clipping the backs and the fronts of the legs under the belly, just so there's not as much hair around the udder. If the kids are going to be nursing off mom, then it keeps it cleaner for them, and then it's better milk quality for when we go to milk that doe as well. Okay, then while the goats are dry, it's a good time to catch up on feet trimming. I don't know about you, but for me personally, that's the one job that kind of gets procrastinated on the most. So mostly because you have goats, you probably know how to trim the feet, but I kind of put that chart up there just as a quick refresher. Basically, you're digging out any dirt, any rocks, and then trying to trim to a nice, fairly rectangular, kind of an oblong rectangular shape. And then I have some pictures here, the actual process. On the bottom right side of your screen, kind of that far away foot on the far right, that would be a good trim. The one that's closest to us, more on the left, you can see that goat is not standing square. Her toes are kind of tilted. And in that case, she would need to be trimmed, especially on that inner toe, so that she is more balanced. And that's what we want, is a nice balanced foot. As far as feeding dry does, which Morgan will get into this more, but I still want to kind of touch on some different diet considerations. So our goal, again, during that dry period is to feed to body condition and maintain that body condition, unless those does came in skinny and we want to get some extra weight on them. If they were under condition, then the goal would be to increase their weight gain gradually. You don't want them getting fat, in just a couple weeks, because that's not very good for rumen health either. But during the dry period, we don't want any fat goats either, because those fat goats are much more likely to develop pregnancy toxemia, which we'll talk about in a bit. Now, with those fat goats, we might want them to lose a little bit of weight during that initial 30 days of the dry period, but we do not want them losing any weight during the second half of the dry period, that last 30 days. Again, that can predispose to preg tox. A lot of farms will have ammonium chloride in their dry goat diets, and that's actually a good thing. That can help minimize milk fever, but I do not recommend using any bicarb or baking soda. I'll see that sometimes offered free choice to those dry goats, and that increases the chance of milk fever. And we'll go into milk fever in a little bit later as well. All right, I think we are ready for a poll. So Jen, can you pop that up for me, please? All right, so my question for you all is, what is the ideal body condition score for a dry doe? We'll give you a few minutes to vote, and then I'm sure Jen, you'll put up everybody's answers.
Yep, we're about 25% voted so far, so keep them coming in. I'll just give you a few more seconds and then I'll close the poll here. All right, it looks like the majority has voted, so I'm going to end that. And Dr. Lauer, you should see those results there.
Yep, perfect. So, yep, it sounds like you all are pretty familiar with goat body condition scoring. This was kind of my test to see what level of knowledge we have. So most of you said a body condition score of 4. The rest, after you said a 5, there were some 3s and some 6s. So thank you for answering that. And we are now actually going to discuss body condition scoring. So body condition scoring, especially in dry does, is very much a hands-on process, especially in the winter, but really any time of year. This isn't something that you can just walk by and score them with your eyes, because if they have multiples, if they have a big old hay belly, you cannot score them. They can look very, very fat, but if you put your hands on them, you can feel that, oh, actually her body condition score really isn't that great. So it needs to be a hand-on process, and it needs to be done by the same person, because everybody will score goats slightly differently. similarly to cows. There's a kind of a range on what you consider the body condition score to be. So there's some things that you're going to want to feel. So over the ribs, along the backbone or the loin area, and then the chest pad, right basically between those front legs. Now this was my trick question, because body condition scoring, the score for goats, it's a 1 to a 5. So in beef cows, it's a 1 to a 9. So yeah, I did kind of put some higher scores on there, but basically we have a 1 to a 5. There can be points in there, so a 2.5, a 3, a 3.5, that sort of thing. Typically, our really good milk producers are going to lose 1 to 2 scores during early lactation because they're milking so heavily. So that's something we need to look for and address both during and after the dry period. And we want them to regain those scores during late lactation. So a body condition score 1, this is a very, very thin, emaciated goat. Basically, you can see the ribs, you can feel the ribs, you can see and feel the backbone. You look at her and it's like, wow, she is skinny. When we see goats in this body condition, at least for me as a vet, this is going to maybe make those warning bells go off of, okay, does this goat have yonis or CAE or some other infectious process going on? If I see a lot of the does in the herd looking like this, then that's telling me that they're just not getting enough energy in the diet. And we really need to address what those goats are getting fed. A body condition score of 2 is going to still be a thin goat, but she does have some fat cover on her. Now a score 2 is going to be an early lactation, heavy milking doe. So this is one where she's giving, 14 pounds a day and she's just milking like crazy. It's not necessarily a bad thing as long as they are milking good, continuing to maintain that milk production. But then once they start getting into late lactation, we want to see them more at a score 3. So these animals have even more of a fat cover. If you feel between that chest, you can easily feel fat there. The loin is fairly level, so when you feel along the backbone, you can still feel the spine, but there's good cover on both sides. And then a score 4, now the animal has quite a bit more fat, but it's still not considered obese. A score 4 is the maximum body condition score we want on a dry doe. Any fatter than this, and again, she's more predisposed for pregnancy toxemia. And then that score 5 is that obese goat. These, when you feel along their backbone, there's actually like a little dimple there because the goat is so fat. And this is not ideal. If there are a lot of does in that herd, then I know they're getting way too many calories during that dry period, and we need to back the energy down. As far as feeding dry goats, during that first 1 to 2 months before they're freshening, before they're due, free choice hay. It's pretty readily available. I like going with a good high quality hay, something that is still soft, something that's definitely palatable, but this does not have to be your second and third cutting alfalfa. It can be your first cutting alfalfa with a lot more grass in there, because while they're dry, they're not producing milk, so there's not as much of an energy demand, especially during that first month in the dry period. Typically don't feed very much grain during the early dry period unless those goats were under condition and we're trying to increase that body condition. Now, a month before the does are due, that's when the process starts to change. So that's when I will start to offer grain and then slowly increase the amount of grain, especially if you know that those does are carrying multiple fetuses. I do offer a free choice loose trace mineral with a fairly high content. That way the does can kind of regulate what they need and when. For me, I'll see it, definitely that last 2 to 3 weeks before the does are due, they're eating a lot of mineral. So I don't want to limit them on that. They're needing a lot of calcium for those fetuses. So I definitely let them consume it. And then again, no bicarb. Now, in Wisconsin, I do have a few farms that are feeding a TMR. It is doable, but there are more challenges that go along with the TMR diet. And again, don't have time to delve into it later, but it is possible to do a decent TMR for dry and lactating does. So why do I push so much for grain during that last month of the dry period? That's because grain is very energy dense, but space conscious. I'm going to say that again. Grain is energy dense, but space conscious. That means there's a ton of energy in a very, very small form so that those does don't have to eat very much to meet their energy requirements. With those does, as they're pregnant, that late lactation, those fetuses are taking up a ton of room in their abdomen. And there's simply no more room for them to go. So they start compressing the rumen, and those does physically cannot eat enough hay to meet their energy requirements. So when that happens, they start basically using the fat that's stored in their body for energy. When that happens, they start losing body condition. And again, pregnancy toxemia or preg tox is far more likely. So preg tox for us veterinarians basically means that there are higher blood ketone levels. We see this most commonly very close to kidding, typically 2 to 3 weeks before kidding, usually in does that have multiples, although on occasion I will see it in does with a singleton if it's a very large singleton and a very small underweight doe. We will see it in over-conditioned does as well, just because they have more fat to metabolize. So more fat means more ketones. Again, those goats, they can't eat enough hay. They use that fat as energy. When the fat is basically metabolized, ketones are the byproduct, and the brain can't use ketones very well for an energy source, which is why we will then see the signs that we see with preg tox. Decreased appetite. Typically, these does are pretty depressed. They have kind of a glassy, glazy eye. They're not very interested in their surroundings. They'll get kind of wobbly. They can start to stargaze where their head is thrown way back and they're just like they're looking at the stars. They can circle, they can start staggering. Once they have severe preg tox, they will go down and you won't be able to get them up, even if you encourage them to. And then unfortunately, they can die from pregnancy toxemia. Usually they've been down for a while at that point in time. Unfortunately, with preg tox, usually the kids die before the dam does. So it's one of those where we kind of lose everybody. So it's not a good situation and definitely something you want to avoid. For diagnosing preg tox, there are multiple different ketone tests available on the market. The BHBA, the beta hydroxybutyrate test, is fairly accurate and also fairly common. There are different models you can use. You can test the blood, you can test the milk, you can test the urine. With the milk, even on those dry does, you can usually get a few drops of milk out of that dry udder, and that's enough for testing. For a BHP level, we don't want anything over a 0.7 millimoles per liter. You can technically measure NEFAs, the non-esterified fatty acids as well, and that level should be less than a 0.4 millimoles per liter. Treatment for a down doe with pregnancy toxemia is going to be a C-section. I know a lot of us veterinarians have tried to save those down does by doing more conservative management. And basically, if she's down and she can't get up, we need to remove those fetuses as soon as possible via a C-section. If you induce those does, because it typically takes 48 hours for the doe to kid, by that point in time, usually the kids are dead and we end up losing the mom as well, even with really, really intensive medical management. It's not always the case, but it's fairly typical. So we want to catch these preg tox does early, long before they go down. As soon as they start looking kind of glassy-eyed, looking a little off, that's the time to catch them. And when we see them that early, increasing grain so that they're getting more energy, again, in a very space-conscious style, is going to be most helpful. And then just increasing exercise in any overweight animals just to try and get them to start metabolizing their own fat so that they are kind of not hopefully going to be as fat. Other things that we will do for treatment, most of the goats that have preg tox also have a little bit of a hypocalcemia or a milk fever. So we will give it a calcium source, usually with an oral form because they're not a true milk fever. I like the goat YMCP because it's got some calcium in there, some magnesium, some phosphorus, also has some yeast, so it's kind of a good way to restart everything and give them kind of a little electrolyte boost. You can use the injectable calcium. Typically 60 cc's under the skin is enough for them. We will treat with propylene glycol as well. This is a drench that you would give orally. Ideally, you don't want to go over 1.5 ounces given in a 24-hour period, just because of, well, one, regurgitation issues and aspiration issues, because goats usually will fight that. And two, if they get too much propylene glycol, it can also cause some other issues. We want to minimize IV dextrose unless those does are in a hospital where they can be on a constant, like low dextrose drip. If a vet's just giving a high dose of dextrose IV, that causes the glucose level to spike really high, and then it drops precipitately. So that will actually make the preg tox worse. So we try and avoid IV dextrose. Prevention, again, exercise, lots and lots of exercise just to try and keep those does from getting overconditioned. One simple way to make them exercise is simply move the stock tank further away. So make them actually walk to the stock tank to get a drink of water. It doesn't take a whole lot of exercise. It's not like you have to run them for a mile or anything like that. Just make them walk a little further than they have been. And yeah, moving that stock tank is a quick, simple way to get them some more exercise. We also want to maximize feed intake during that last month and closely monitor body condition. Make sure that they're not getting too fat, but they're not getting too thin as well. And then feeding them that energy dense grain diet. And then decreasing stress. So if the does are overcrowded, they're having to fight for feed, having to fight for space, that's more likely to cause preg tox too, because those goats simply can't eat enough of whatever feed is available. So decreasing that stress, decreasing crowding is another definite goal. Okay, now one thing I wanted to touch on would be the dolings or the yearlings. With them, they are both trying to grow their own kids and they are still growing themselves. So dolings have a lot higher energy requirement than our pregnant older does, because we still want them to grow. We want them to reach their maximum genetic potential. So they typically will need grain throughout that quote unquote dry period, even though they're not dry, because they are growing. A lot of farms will leave a coccidiostat in until about a month before they're due. They shouldn't technically need a coccidiostat after they're 6 months old, but they're cheap and a lot of people just leave them in there. I do not ever recommend feeding a milking, like a dry milking goat grain to those dolings or those yearlings. That's because there's a higher level of calcium in there, and I have seen some pretty nasty cases of rickets. So make sure those dolings are kept on a grower feed. Okay, so the dry period is over. That doe is getting ready to freshen. Just wanted to list some signs that indicate that she is getting ready to have her kids. It's important that those does do have a nice, clean, dry kidding area and one that isn't overcrowded. We want to make sure that she has lots of space so that she can kid in peace. She doesn't have to be by herself, but we want to make sure that she's not crowded. So one of the first signs that I'll typically see is that those pelvic ligaments will start to relax, usually in that 12 to 18 hours before she's due, although sometimes I've seen them lose them a lot earlier than that. Usually they're uddering up. That can start anywhere from 3 weeks before they're due until maybe the day that they are due and they start kidding. When the big day is going to happen, they'll separate themselves from the herd. They're usually listless, they're pawing at the ground, they're nesting. You can see that their teat ends will actually fill with milk as well. And usually when that happens, it means that she's within 12 hours of kidding. Then when you see that mucus cord hanging out, kids should be on the ground in 2 to 3 hours. That's the typical goal. And then of course, when she starts straining, so when she starts having those abdominal contractions and she's actively pushing those kids out, you know that she's ready. Now, when do I recommend intervening? Because goats, because they have those multiples, it's much more likely that you're going to be pulling kids at some point in time. So my rules for reaching in, first off, if that mucus cord passed over 3 hours ago and she hasn't been doing anything, I'm going to reach in and just make sure that everything is okay. For my does that have taken longer than 3 hours to really do anything after they pass that mucus cord, most of them have ended up with either a frank breach or some sort of malpositioning of those kids. So I don't wait too long because I don't want to lose any of those kids. If the doe has been straining for 15 minutes, so 15 minutes of full on pushing and no kids are out yet, it's time to reach in and see what's going on. Also, if there are feet but no head, so maybe the head is back, or maybe there's a twin or a triplet who's trying to come out at the same time, time to reach in, see what's going on. Same thing, if there's a head but no feet or just a tail, then those kids are probably a little tangled up and need some help. Also, if you see any yellow staining, so if one kid was delivered with yellow staining, or when you reach in and the mucus on your hand is yellow stained, that's telling you that the kids in the uterus are stressed and they need to come out ASAP before they die, because that yellow staining is the meconium or the poop, and they only do that when they're very stressed. Before I reach in, I do use a nice clean palpation sleeve with lots of lube. I will clean up the back end of the doe just with some soap and warm water so that everything is as clean as possible. It's very important to be gentle, very, very gentle, and the smaller hands, the better. Goats are not like cows where you can just shove your hand there as quickly as you can. You've got to go slow and steady with nice, gentle pressure, and don't shove any hands in quickly. The smaller the hands, the better. Unfortunately, there are some men who their hands are just not big enough to fit in those does. So oftentimes the wife or daughter or some other woman on the farm is usually the best one to help hold those kids. Once that doe has freshened, then we want to take good care of her so that she can get off to a good start. I like offering clean, warm water. If I put a bucket of nice warm water down in front of that doe, she's usually going to drink a solid gallon right then and there. You can put some YMCP in there just to kind of give her a boost. Some does will drink it, others won't. So it just kind of depends on your herd. Some people will put molasses in there as well, just for a little bit of an energy boost. And then we do want to milk those does as soon as possible. And that's so we can get the highest quality colostrum from that doe where it's not diluted out with milk. And then also when we milk her, it's going to cause a natural oxytocin release, and that is going to help her pass her placenta faster. And then after that, we just want to make sure she's not crowded. She has access to hay, grain, water, and is nice and comfortable. And then switching them on to an actual lactating goat diet. Lactation is the greatest energy demand because those does are making a lot of milk. That's their whole point. It takes a lot of energy to make that milk. So these lactating does can lose body condition fairly rapidly. It's expected, but we try and minimize it as much as possible. So during that lactating period, I like to feed a very good, high quality alfalfa hay. Make sure it's nice and soft and leafy, very palatable, no mold, nothing like that. And then feed grain in the parlor or on the milk stand, or you can feed it to everybody as well in a trough or whatever way you have for feeding them. I keep that free choice loose trace mineral available at all times. And then bicarb is one of those where I'm not really sold on it. I've tried it with my does. I haven't seen any benefits in milk production, components, anything like that. But it's not going to hurt offering bicarb to lactating does, just not to dry does. Okay, I said I was going to touch on milk fever. We're getting close on my time being done. So I want to whiz through this. Milk fever is basically hypocalcemia or low blood calcium. It is not very common in goats, but it does certainly happen. That's why I have a picture of a cow, because it's way more common in cows. With goats, with milk fever, they're typically not chewing their cud. If they are chewing their cud, it's very weak. They're not having very many rumen contractions. The goats themselves can be weak or wobbly and then progress to going down. And they can have what's called an S-curve to their neck. So if you look at that cow lying there, you kind of imagine she's got this little S-curve shape to her. treatment is with basically the cattle calcium solution. You give it, you give it sub-Q, so typically 60 mLs or 60 cc's under the skin. I divide that between at least 2 spots, and then repeat that every couple hours until the goat is up and doing well. You can give calcium IV, but you have to give it very, very slowly, because too fast and you will stop the doe's heart rate. And we certainly don't want that happening. Ammonium chloride does help prevent milk fever in goats as well. And then retained placentas, which can happen in goats, but thankfully, again, it's not as common as it happens in cows. We sometimes think it's linked to a subclinical milk fever, but I've seen it more on farms where they have just minimal vitamin E or selenium levels. So with those farms, we actually recommend doing a better trace mineral, getting more vitamin E, selenium available to those does, and that has actually helped way more versus monitoring the blood calcium. Retained placentas are more common if that goat aborted or if she had a mummified fetus. Just an FYI there. For treatment, I will still do some YMCP, just more as a pick-me-up than anything else. I'll give the BOCI or the Multimin if I didn't give it in that dry period. As far as antibiotics go, there are no antibiotics labeled for metritis in goats, so everything is extra label, and a vet would need to recommend it. If the goat does have a fever, then we do typically recommend antibiotics. All right, I think it's time for our last poll there, Jen.
All right, you should see the poll there, Vicki.
Yep, I see it. Okay, my last poll question for you all is, what is the most common sign of mastitis in goats? So would it be flakes or chunks in the milk, watery milk, a swollen half, a smaller half, or a hot, painful half? So go ahead and cast your vote, and then we will talk about mastitis very quickly.
We'll give them a few more seconds to log in, and had some good comments and good questions coming in the chat box. So keep putting those in, and we'll address those when we get after Morgan's presentation. We'll address all the questions. And I'm going to close the poll there, Vicki, and we'll share those results.
All right, so looks like most of you said that a hot, painful half is the most common sign of mastitis, followed by flakes or chunks in the milk, then a swollen half, then watery milk, then a smaller half. Okay, so good to know. Again, mastitis is something that we could talk about for a while. Hold on, my screen is not wanting me to advance. There we go. So mastitis in goats is very different from what it is in cows. And this is one of those things I like to talk to all my goat producers about, because it can kind of throw you for a loop because it's not like cows. So in about 95% of goats with mastitis, what you will see is actually a light or a smaller half. So on this picture right there, if you look at that doe, her left half is a lot smaller than her right. The left half is the side with mastitis, not the right side, for 95% of the mastitis cases. The milk will almost never have flakes or chunks for a mastitis. About 5% of does will have what we call a hot mastitis, and that is what we see more commonly in cows, where that half will be hard, it will be swollen, it will be hot, it will be painful to the touch. With that, sometimes the milk will be watery, but that, like I said, that's only about 5% of the mastitis cases in goats. When they do have a hot mastitis, then those goats do need much more aggressive treatment. So they're usually going to need some IV fluids, some pain meds, some anti-inflammatories, that sort of thing. But otherwise, for that 95% of mastitis that we see that is more of a subclinical mastitis, those do need to be treated with the lactating cow tubes. And with that, we do like to collect a sterile milk sample first. So cleaning off that teat end with some rubbing alcohol, making sure that no debris falls into the test tube. You get that milk sample, you put the goat's name or number or whatever on there along with the date, throw it into the freezer and save it. You might not need it, but let's say that first treatment doesn't work. Now you have that clean culture that you can send to a lab and find out what bacteria is causing this. Some are contagious, some are not. Staph aureus is very common in goats, and if we have Staph aureus in the herd and decide we want to become negative, having that sterile sample that we can refer to later is definitely a plus. If that goat does need to be treated because she has mastitis, it will be one full lactating tube per half. But unfortunately, a lot of does will not, they won't respond very well during the lactating period. Usually that half will stay light, their somatic cell count will remain elevated. The best way to treat her is during that dry period. So doing those dry cow tubes during the dry period is when we're most likely to cause resolution of that mastitis. Again, we could talk about this for a long time. So if you want to learn more about mastitis, definitely let everyone know in that survey or later on in the chat. And that is it for me. So we're going to save questions till the end of Morgan's, and then hopefully I can answer any questions you all have. Thank you all for listening.
Well, thanks, Dr. Lauer, for that presentation, and we can probably all give you a virtual hand clap in our virtual world here today for being on the webinar. But great presentation, great comments, and again, we'll address those questions at the end of the webinar here today. So Morgan, if you want to go ahead and start sharing your screen, we'll go ahead and get you loaded up here and start off the second presentation on feeding and kind of more of the management practices of that transition doe here. And I know as Morgan's loading her presentation, Vicki, I know Dr. Leo Timms from ISU, he'd be more than willing to present on milk quality and have a whole webinar just based on that as well. So that might be something to think about in the future too.
All right, can everybody hear me?
And
okay, great. I'm gonna get this opened up here. So thanks everybody for joining us today. Thank you, Dr. Lauer, for your presentation. And when we were asked to do this together, I know we both submitted our presentations and we kind of just made sure that they meshed and that there wasn't a lot of overlap. And I think it was kind of fun. We had some just kind of some similar concerns when talking about transition does. So it's good to know that as an industry, we've got nutritionists and veterinarians and industry representatives that are working to address some of the most common problems that we see with transition does and goats in general now. So Jen introduced me earlier, but I work as a nutritionist for Big Gain, and I do mostly dairy cattle nutrition, but more and more, especially being near Minnesota and Iowa, we have a lot of goats to work with. So that's really fun for me because I grew up with goats, and my husband and I currently have a small commercial goat dairy. We do raise breeding stock also. So we have sort of a non-traditional breed on our dairy. We raise Oberhasli. Okay, so first I'm going to talk about just what are our goals. So first of all, what is a transition doe? So it's a goat that is dry and pregnant, and then she's moving into being milking and not pregnant. So what can we do to make that go good? As we all know, if something's going to go wrong, it's right at the time of kidding. So our goals are to optimize milk production, to maintain or minimize weight loss, to reduce metabolic disease, have a strong immune response. That immune system really fuels all kinds of things in the doe. And then finally, just to produce healthy kids. So for your dry doe diets, excuse me, these rations aren't nearly as specialized as dry cow diets. And part of that is because of kind of the picky nature of goats. So we can't do things that are specialized. We can't use some of the calcium salts that we use. We can't, feed a lot of wheat straw and corn silage and all that kind of stuff because goats are picky eaters. So we're going to do the best we can with what we know that goats are going to eat. So focus on low potassium and low sodium forages. So consider decad balancing, but just kind of monitoring that with the type of forages you're buying. You might want to consider supplemental magnesium and calcium. Also control energy intake, which Dr. Lauer talked about quite a bit. Too much or too little can be detrimental. Really monitor the body condition score of your herd. And then provide enough metabolizable protein before kidding. So this doesn't mean just feed straight up 14% protein, 16% protein, 18% protein, pick a number. What you want to do is make sure that you are providing the amino acids to these does. And then maximize dry matter intake, really important. And I've got a slide later, but those kids take up a lot of space. So we have to make sure that they're eating enough to provide enough energy to grow those kids. And just sort of a very general, I'm not going to give any specific recommendations because every herd is different, but provide a free choice quality forage and grain at maybe 1 pound per day while you watch the body condition. And this would be the last 6 weeks, 8 to 6 weeks, 6 weeks for sure, as those kids continue to grow, just to transition them into moving on to grain again after you dry off. Okay, so I'm going to scoot my little picture out of the way over here. So dry doe nutrition is important for the development of those unborn kids. So they really, really grow a lot in the last 6 weeks of pregnancy. That's why we say start to feed grain those last six weeks of pregnancy. Really make that transition those last 45 days. Monitor the body condition. Make sure your does aren't too thin. Make sure that they're not gaining too much weight because that causes trouble. Always provide fresh water. And like Dr. Lauer said, to maybe put that a little bit away from where the does like to rest or right next to the feed bunk. It gives them a chance to get some exercise. And then clean and dry pens, make sure that you have adequate resting and bunk space. You think about somebody recommending maybe 10 inches of bunk space, but if you get behind the does in your herd, you see how wide those bellies are getting in late gestation, you know that you need more than 10 inches of bunk space. So some of those does might have a 2.5 feet of belly basically, and they can't all shove up to the bunk at the same time. So really pay attention to that. And then monitor your BHBAs for pregnancy toxemia. I think when we talk about metabolic disorders, this is kind of really our biggest issue with goat herds. We talked a little bit about milk fever in the last presentation and retained placentas. Just not something that we see as often as pregnancy toxemia. There we go. And so this is just kind of a continuation of that pregnancy toxemia, but just because you got twins or triplets, they're taking up a ton of space, the ruminal capacity is reduced because of all the kids, and she can't eat enough to meet the demands of those growing kids. So learn the signs and do your own testing. And I saw that somebody had popped up in the chat bar just to look at the lower legs also for swelling. Look at those does that can't get up. Look at the does that kind of hang out in the back while you're feeding. So I made, and it's, so those are some signs that you can see, like, hey, I think this doe has trouble. But we can actually do like a goat side testing for ketones. So I did a short video. Now nobody can laugh at me. I did this in one take. My husband did it for me, so he wasn't super thrilled. He did the videoing. So we'll just get this started. This kind of gives you an idea of how simple it is. And I'm going to make sure that my computer sound goes. And Jen, maybe give me a thumbs up if you can hear this.
Hey, so I'm going to give you a quick tutorial on drawing blood from your doe to check for pregnancy toxemia. So we're going to look for blood ketones, and this is what you're going to need. So first of all, I have a glucose and ketone meter. I have a syringe for drawing blood. It has a 20 gauge needle on it. And then these are your glucose and ketone strips. And you can purchase the meter for probably $50 to $75. And these strips you can get for around $1 to $1.50 each. And today I'm going to use this fitting stand, which works really well to hold their head in place. It makes it a one-person job. Now, if you have a doe that you actually suspect has pregnancy toxemia, you're probably not going to be able to get her on a stand, in which case you can just tie her with a halter or have somebody hold her. But for today, for just the visual, I'm going to use the stand. This doe here is a yearling. She's dry. She's not due for about 50 days. And so she's pretty low risk for pregnancy toxemia, but she just happened to be my first doe to the gate. So that's who we're gonna do today. So if you wanna come around to the side here, I'm gonna just lock her head down to hold her head in place. I always draw blood from the left side. So if you're looking the same direction the goat is, the left side. And for this meter, you only just need a drop of blood, so you don't need much at all. But just look for the vein here on their neck. And you can see that we got just a little bit. It's way more than I actually need, but we'll go ahead and use that right away. We'll let this doe's head out. So I'm going to go ahead and get our ketone strip first. And these meters will just turn right on. You want to make sure the battery's good. I checked mine, so hopefully it's not too cold. But you just tear the foil off and expose the tip of that strip. And you put that in, and then your meter will turn on. And it'll give you, when this little rain droplet is kind of showing there, that means it's ready. So we're gonna put just a drop on there, just like that. And it tells you it's working. And it's got a countdown there so you can watch it count down. Okay, so this doe is a 0.5. So when we're monitoring our herd for pregnancy toxemia, anything over a 1 would be considered something that I would treat. Anything over a 1.5 for sure would need to be treated. So I'm going to go ahead and pull out the glucose strip next. These are a different color so you can easily find them. Again, pull the top of the foil off. Put that in the meter and it'll turn on. We got the same syringe of blood and you can see it's ready because of the little droplet there. This one goes a little bit quicker. So she's a 51 on her glucose. So goats will be anywhere from 45 to 75 maybe on glucose. Not super imperative with her right now because she's dry. It'd be maybe something we'd look at more in a fresh animal. But that's just a quick video on checking for BHBA or ketones when you're monitoring your herd for pregnancy toxemia.
All right. Hopefully everybody could hear that and see that okay? Good. Okay, so if you have any questions about that, you can put it into that chat bar there. So the dry goats, just highly palatable feed, a little bit of grain in that last 6 weeks. Look for low potassium, low sodium forages. And, you know, if you are going to do a custom grain mix, you know, we can do some more of the calcium, magnesium, some more of the mineral type additives, but those are some basic general recommendations, and of course monitor your body condition. So now coming into our fresh dose, so hopefully we've kitted, nice set of twins, no troubles, no metabolic problems. So that's our big goal. And now peak lactation generally occurs between 40 and 60 days, but the goats don't generally peak on their intake until they're 80 to 110 days of milk. So that's when that's why we lose some body condition, because they're milking more than they can eat and energy to produce that milk. So again, careful consideration of body condition. You don't want these does freshening in so thin. Just like Vicki said, they could lose 1 to 2 body condition scores. We don't want to drop them down to being very thin. So really pay attention to that. And then the doe's nutrient intake will not meet the demands until her milk starts to drop from 60 to 80% of her peak. This is a slide that I got from, actually it was from Dee Laval's website, and it is for cows. And so I think it kind of shows the curves here. And I think you can maybe see my cursor here, but here's your peak milk. You can see this point here. Then you can see that the dry matter intake doesn't come for quite a bit later. Now on goats, we could probably slide this whole graph maybe 20 days closer. I think they peak in their milk and in their intake a little bit quicker than cattle do, because we have less of a severe weight loss post-kidding than cows have post-calving. But it just kind of gives you a good kind of visual of what happens. So we have this peak milk, the goats are losing weight, but they don't start to eat their peak level until a little bit later. And then that's when you see that body weight start to come up. So just think about that as you're feeding your fresh does also. Okay, so even though, you know, we have this negative energy balance, we really can't avoid it, but we can do some things to try to lessen what happens there. So we want to encourage high dry matter intake, and that will help reduce the weight loss and reach peak milk sooner. So how do we encourage high dry matter intakes? So we can feed really high quality forages. If you have alfalfa or corn silage, or if you have really good quality grass also. And if you have questions about choosing forages or about reading forage samples, you can pop those into the question box or the chat box also. And then increase your energy. So those lower intakes after kidding means that you need more dense energy diet. And Dr. Lauer kind of touched on this too. And so you need to feed more carbohydrates in the form of digestible fibers or starch, and then also adding some fat in can make a difference too. Now you have to be careful with the type of fat you feed, but it can be beneficial. And increase your protein. Fresh does might need a 17 to 19% crude protein diet. But remember, that's not just the grain you feed. So if you have hay like this little handful up on the top of the screen here, this might be 25% protein baleage. So then you have to pair that with a grain mix that gives you that kind of 17 to 19% crude protein diet. You don't want to feed a lot of protein because it takes energy to break that down. And then what's not needed is excreted, and you'll get kind of that ammonia smell in the urine, or you'll have high MUNs in your milk. And that's a good indication that you're feeding too much protein. And also, again, pay attention to the amino acid supply and use your forage analysis to really dial in these fresh goat rations. Okay. I made a few notes here. I want to make sure I hit everything. So if I go back to this last slide here, I think there was another question that kind of popped up, and I thought I could throw it in here, but kind of a general recommendation on how much to feed. If you wonder what the dry matter intake of your herd should be, we always talk about dry matter because, and it's not maybe as important in goats because we're not feeding a lot of high moisture, corn silage, corn, baleage, and that kind of thing, but they eat in terms of dry matter. And so most goats will have about a 7 to 8 pound dry matter intake if you're raising a large framed breed. So you can take the weight of your goat and times it by 4.5%. So if you've got 150 or 160 pound average herd, times that by 4.5%, that gives you a pretty good idea of how much they will eat in dry matter per day. And then if you're feeding all hay, you can get by with pretty close to half and half on a dry matter basis of grain and forage. So you can split that if you want to do 4 pounds of hay and 4 pounds of grain, or 3.5 pounds of grain and 4.5 pounds of hay. That gives you a pretty good idea of what they should be eating. So that's just a kind of a quick recommendation without any specifics based on herd dynamics or forage quality. Okay, so again, as these does freshen, these first 3 weeks post kidding, we really want to make sure they're getting off to a good start. So Monitor your fresh does with the BHBA and the glucose testing. Make sure that you don't have subclinical ketosis. Goats, it's not as common as cattle are. And then also check your glucose. Make sure that the goats are getting enough to eat. And so that dry doe I did, she was like a 51 or something like that for glucose. On fresh goats, we're probably going to see a lot of them between 55 and 65. So that would be your goal for glucose. If you get any higher than that, you're looking at some kind of metabolic acidosis even. So be careful with that. Not necessarily ruminal acidosis, but just something to caution when you're testing for glucose, some things to watch for. And then, don't be afraid to feed some corn to these fresh goats, some starch. But when that starch ferments, it produces propionate, and that produces glucose. And glucose really fuels the immune system. And if you have a strong immune system, it fights things like your mastitis and any respiratory problems like upper respiratory or pneumonia. So it's important to have enough glucose to fuel that immune system to keep your herd healthy. So feed enough starch and energy for maximum production without lowering rumen pH. So I said you could feed a 50-50 grain and forage diet, but you don't want to get them too much borderline where you're going to lower rumen pH and produce acidosis. And if you are selling milk, you can monitor your butter fat and your protein. Now there's a lot of things that go into producing butter fat, which we're not going to talk about here today. And most of them don't have much to do with rumen acidosis, actually, especially in goats. So just make sure the herd's healthy, they're chewing their cud, and that they're milking well. Okay, if you are doing custom grain mixes, this little picture down here in the corner is just like a screenshot of what a nutritionist is looking at. You can see that there's just a ton of information there that we can use and that we can see. Not a lot of people get a completely custom mix unless you're a larger commercial herd, but there's so many things we have to pay attention to that you don't with cattle. A lot of goat herds are getting a pellet or a pellet mixed with corn. So we have to pay attention to what makes a good pellet. So that gives us some limitations. And also, what will your goats eat? I mean, as a nutritionist, that's the biggest thing. Like, you sold me feed that my goats won't eat. Well, it happens. We know that some of the things that would be really good for goats, like an extra methionine source, they don't like to eat it. So those are some things as a nutritionist that make it a little bit hard for us. But if you're doing a custom mix, make sure you talk to your nutritionist about your amino acids, and that's both the grams, the concentrate, and the concentration of lysine and methionine as a percent of metabolizable protein. And then we can also talk about fatty acid levels and sources. And this is one area, amino acids and fatty acids, that really affect your butter fat also. So the whole little section to the upper right of that nutrition kind of model screen there is looking at our fatty acid supply. And some of those can really drop butter fat or really inhibit milk production too in the fresh animal. Physically effective fiber, that's pretty straightforward. And then rumen fermentable carbohydrates, which all the sources of carbohydrates from forages and grains and corn, et cetera, they get into that rumen and they produce this kind of pool of carbohydrates that are available for energy for milk production. So those are some things that you can look at if you are balancing diets for fresh goats. And it can get really specific, and that's why I said it's kind of a herd by herd basis. But also, lots of things to think about and lots of opportunity to make improvements in your herd. Okay, so that's some kind of basic stuff about nutrition and transitioning those does. Get them from dry and pregnant, healthy kids, get them milking those first 3 weeks post kidding. You want to get close to that peak milk without having any troubles. And so what are some things besides what we're feeding them that we can do to make it go better? And this is just kind of one simple slide here, but what's the crowding like in your barn? Do you provide 20 square foot per head or more? How about heat abatement in the summer? It gets pretty hot and humid here in the Midwest. Do you have fans in your barns? Are you controlling flies? What about bunk space? Can every doe get up to the bunk and eat at the same time? This is my small herd here in the picture, but you can see that the goats don't like to take turns eating. When you put feed up there, they all get up at the same time and want to eat. And then clean and dry bedding. Can you sit down in the bedding and it's comfortable for you? You don't get dirty, you don't get wet. Water, cleanliness, and access. They're not pooping or climbing in the water. I call on a number of herds that have water fountains, like what would be in an old freestyle barn or that have been put in for goats. And it doesn't matter what barn I walk into, there's always a goat standing on top of the water fountain. So make sure that there's not a lot of poop in the water. And then just the last thing is disease management. CAE, CL, and Yonis, they can play a really big role in how your does transition and your overall herd health. If we're having any kind of degenerative disease that causes trouble with motion and getting around it, and the weight of the animal too, it can cause some big problems with the productivity of our herds. And I think pretty close to done here. So yeah, and just this is almost my last slide here. So your does in early lactation have this really high energy demand, not entirely met through your feed intake. So you can't prevent this deficit from happening, but we can lessen it by promoting greater energy intake in early lactation. We can add in grains and fats and high quality forage, and these provide or play a really important role in supplying energy to those transition does. And so my final slide is just, do you have any questions? Type them into the chat bar. I think we've got a few minutes. Hopefully I'm in my time, Jen. And we'll just turn it over to you.
All right. Well, thanks, Morgan, for that great presentation.
Yeah.
Very, very good hands-on practical things that these producers can take home and utilize. So I appreciate that. Kind of going into the chat box, and I think these are going to be for both Dr. Lauer and Morgan, so whoever feels more comfortable answering them, go ahead. First one I see here is Timothy or alfalfa pellets all right to use?
I think I'm still on, yeah. Yeah, they would be okay to use. I don't have a lot of, I guess, personal experience using the pellets, but I think they're fine. You know, we talked about physically effective fiber a little bit in my presentation. And so if you're using it as a supplement to maybe like a rougher type of hay, it's probably good, but you want to make sure that you provide some physically effective fiber. And what that would be a good, 1.5 inches in length for sure. So when you think about alfalfa pellets or Timothy pellets, it's ground and then repelleted. And so you lose some of that, the physical properties of that forage. So that would be my only kind of comment on it, would just be to watch that. I don't know if Vicki has any other comments.
Yeah, I've tried the alfalfa pellets just on my goats to see if they would eat it. They wouldn't touch it. I mean, I left it out in the feeder and tried multiple times, and yeah, they wouldn't touch it. So I think it will depend on what your goats eat more than anything else.
Great. And another question, Morgan, you had mentioned, making sure you have a good fat. So what forms of fat do you recommend?
Yeah, and so this could be a whole presentation on its own, but when we break down these different fatty acids, first you have saturated and unsaturated. And so your unsaturated fats, when they go into the rumen, you have to, the rumen has to saturate them to start with. So that takes some time and some energy to do. And also some of those unsaturated fats can do some coating of the fibers in the rumen. So if you're going to dump like straight soy oil or something like that into your feed, that's not a great idea. So what I would look at would be something that provides like a C18-1. Now these are just like breaking down the fats, but that would be something you could use like a palm fat or using some other type of saturated fat in that diet. Things to avoid would be a lot of fat from like soy oil or distillers grains. The C18-2 are your steric fats. So I don't know I guess it would be kind of a specific question and looking at probably the gram contribution of those fats. But, you know, fats from things like cottonseed and sunflower seeds, those can be fine too, just as long as you're not feeding a ton of it. So I don't know if there was like a more specific question to that, but we break down the fatty acid profile of all ingredients, you know, your C18, 1, 2, and 3s, and we look at the contribution of all of those and how many grams end up in the rumen. So it's kind of a, I don't know, probably a bigger question than we have time to answer. But
sure. Yeah, and there was another question about a spreadsheet or a calculator. You know, there was mention of Langston has a calculator. Are there any other spreadsheets available to help with balancing?
Yeah, Langston's probably, I have like a small amount of use on the Langston calculator. That's probably going to be your easiest one. I don't know of any other ones. I'm not sure, Vicki, if you know of any other kind of free sort of spreadsheet or tools online to use. I think Langston's probably going to be your best bet.
Yeah, that's the only one I'm familiar with as well.
Yeah.
All right. And then the question about the ketone strips, do they work on milk too? They've always used in urine, but just wondering if milk is available.
Yep, so there are some milk ketone strips. It actually will say on there. So like the Porter BHB milk ketone strips are for milk. So that's one option. Then there's another like just called milk ketone strip. So yeah, a couple different options.
Yeah, I think there might even be some kind of powders too available for milk. The big thing with using it on goats, though, is goats tend to show symptoms of ketosis before they freshen. So most does are dry at that time. And that's why blood makes it kind of easy. Or I guess if you could get your, you know, if you're good at checking the urine. But yeah, there are those milk strips available.
All right, great question. And just a comment going back to the spreadsheet calculator, Iowa State University, its brand, ISU Brands, has a calculator for small ruminants for goat nutrition, but there is a small fee to purchase that program, but that would be available as well. And I could check into the link and get some more resources on that as well. Yeah, there's a question on linking that, so I'll definitely include that in the resources. We're kind of wrapping up here in the last minute or so. Another question about just, you know, providing sufficient protein and just letting the rumen microbes be responsible for the amino acids needed. I know there's a question about adding those. Any comments on that?
Yeah, so a certain amount of amino acids will be provided by the rumen, and that'll be, you know, as your intake rises, you're going to get more grams of lysine and methionine provided. But if we're looking to really push peak production in your milking herd, you really need to improve that concentration as part of MP. So providing additional grams of lysine and methionine can make a big difference in terms of production and your components, both butter, fat, and protein. Lysine, the synthetic forms of lysine can't be pelleted, and so that makes it hard to actually add lysine to the diet. You can get it from things like blood meal, which most goat producers don't want to use, and even palatability wise, we probably wouldn't recommend using it. So there are some limitations there, but yeah, certainly you do get some amino acids from the rumen, and as intake increases, that also increases. But just like anything else, if we want to push for higher production, feeding those additional sources can make a big difference.
And do you recommend introducing the milking pellet to dry does during the last weeks of the dry period to help them transition better?
You know, Vicki, you had mentioned a little bit about this, not feeding the milking doe feed to your dry doe feed just because of, you know, like your sodium level and stuff is going to be higher. And so, you know, there are some differences there that most goat feeds aren't DCAD balanced, dry goat feeds, so we're not getting like a -15 DCAD in these dry goat diets. They're honestly probably going to be very similar to the lactating diet, just maybe a little bit lower in protein. I don't usually see a big problem with introducing lactating pellets before the does freshen. I don't know, Vicki, maybe you have some extra comments. I don't usually see a big problem with it, but certainly if we're going to get really picky and we want to do things right, it wouldn't be exactly the right thing to do.
Yeah, so on a small herd, I will do just the milking goat pellets and start introducing those to the dry does, just not the yearlings or the dolings. That's where I've seen the rickets. But otherwise, yeah, for me personally, I just use the milking goat pellet because I'm not large enough to have a dry goat pellet. And yeah, I'll start using that milking goat pellet in that last month before they're due.
Great, that was a good question. I know we have a few more questions to address, and there may be some people that have to log off early, but so I just want to make some last comments and then we'll go back to some more of these questions. But I did put into the chat box the evaluation for today's webinar, which I will also email to the participants to fill out if they can't right now, but it is a Qualtrics link that just helps evaluate our program. And then also I put in the registration link to the next webinar that we'll have coming up in March if they want to already pre-register for that. And there was a question about the copy of the PowerPoints. And if you scroll all the way up to the top of the chat box, there's 2 PDF files of the PowerPoints here today that you can download. And then I also will post those along with the recorded webinar here today on our website, which I'll send out to everybody that registered here today. So just some last comments on that while we address a few more questions. Are you guys good with addressing a few more or a couple more minutes? Okay. All right. Let me scroll back up to my chat box here. And I know there was some early on, Vicki, that came in during your presentation. Oh, would you ever milk an animal prior to kidding if the udder looks overfull?
Well, that's a good question. So if we milk the doe, we are going to milk out that colostrum. And we really want that colostrum for the kids. And so if you did milk out that doe just to try and release that pressure, you could save that colostrum for the kids, or, you know, if she's a super stellar milker, I've had some where, yeah, they basically 2 weeks before they're due, they have a huge udder and you could start milking them before they even freshened. In that case, then you'd want to use colostrum replacer on the kids. But it's kind of one of the catch-22. Like I said, you're either going to have to get in there. I have not seen it cause mastitis, but once she does actually freshen and start milking, she usually takes off and milks amazing. So if it were me, I would probably just wait until after she freshens.
All right, then a couple questions on some top dressing. Is it okay to top dress Biotin 100 for good care?
That's probably a Morgan question.
Okay. Yeah, the Biotin 100, it's probably for like a foot health type of thing, or I don't know if they can, maybe it's probably fine to top dress as long as they're following the recommended gram dosage for the weight or however that's dosed. I'm not super familiar with the problem, but with the product, but I'm guessing it's for like a foot health, for managing hoof integrity or foot rot or something like that would be my guess.
And then a question on using horse alfalfa pellets. Is that okay to use?
They'd be the same as any alfalfa pellet. Yeah.
All right. And I guess Vicki or Morgan, do you see any other questions that I missed?
I saw someone asking about Replimon plus paste, if they could use that instead of either the Bose or the Multimin injectable. I have people who use the Replimon and it seems to work okay. It's not as concentrated as the Bose or the Musi, so it might need to be given more frequently and more of it.
There was a question, Vicki, I think in your presentation about, is there calcium in TMS?
TMS. I'm not sure what they're referring to for the TMS.
And maybe they misheard you or something. I'm not sure, but okay.
There's calcium in the YMCP, if that's what they're asking about.
Okay. Yeah, I'm not sure.
I do see a question. Someone's asking if they should culture the milk sample first instead of freezing it, and that's a good question. So if you want to culture every single animal, yeah, you can certainly do that. Usually you would still freeze it and then submit it for culture, just so that the sample isn't basically, rotten by the time it gets to the lab. But it gets pricey if you're culturing every single animal. So that's why I typically will just have farms freeze it and then submit for culture if really necessary.
All right, Dr. Lauer and Morgan, it looks like we've kind of gone through all the questions. So I appreciate you both being on the webinar here today. You answered a lot of really good questions, a lot of good management practices, and encourage everyone to fill out that Qualtrics evaluation links. That helps us develop more educational programs for our dairy goat producers in the future. And we'll keep you posted on upcoming webinars and information that we may be able to present to you. So again, thanks for being on the call, and we'll see you next time.
Yeah, thank you. And I'll just say too, if anybody has any further questions, you can always feel free to reach out to me. If you're, most people are kind of in our trade area, you've got some good forage analysis labs. Dairyland and Rock River are good to choose from. I can always help with that. Or if you've got any feed related questions or like analysis type questions, we're here to help if you need it. So feel free to reach out too. That's fine with me.
All right, thank you both, and hope everybody has a good day.
Yep, thank you.
Bye.